California Attorney General Rob Bonta has issued a strong defense of gender-affirming care for transgender youth, directly countering former President Donald Trump's attempts to restrict access to such treatments nationwide. In a statement to The Guardian, Bonta unequivocally affirmed the legal obligation of healthcare providers in California to continue offering these vital services. His message served as a forceful reassurance to the transgender community amidst growing anxieties fueled by Trump's actions. The law requires hospitals to continue to provide gender-affirming care to our transgender community, Bonta, a Democrat, stated emphatically on Wednesday. He underscored the unwavering commitment of his office to safeguarding the rights and well-being of transgender individuals. "We will have the transgender communities back. We will fight for their rights, for their protections, for their freedoms," he declared, highlighting the state's resolute stance against discriminatory practices targeting this vulnerable population. However, a ripple effect of Trump's pronouncements has already manifested in some California hospitals, temporarily suspending the initiation of gender-affirming hormone treatments for transgender minors. This action, despite the established consensus within major U.S. medical associations that these treatments are integral to the standard of care for gender dysphoria, has sparked widespread concern among trans patients, their families, and civil rights advocates. The disruption in care is viewed as potentially catastrophic for the physical and mental health of affected individuals, leading to calls for immediate action to prevent further harm. The legal arguments against Trump's order are multifaceted. Critics contend that it's not only unlawful, violating both patients' constitutional rights and the rights of parents to make healthcare decisions for their children, but also that hospitals possess no legitimate basis to preemptively deny care, especially while the order's legality remains under judicial scrutiny. The argument centers on the idea that withholding necessary medical treatment based on political maneuvering, before any definitive legal ruling, constitutes a clear infringement on fundamental rights. Children's Hospital Los Angeles, CLA, a prominent healthcare provider in the state, announced on Tuesday a temporary halt to new gender-affirming hormone treatments for transgender youth. Their stated reason was a need to thoroughly assess the implications of Trump's. While assuring that ongoing treatment for existing patients would continue uninterrupted, this decision nonetheless ignited a firestorm of criticism. The hospital's actions were swiftly met with a sharp rebuke from Attorney General Bonta, who sent a strongly worded letter to CLA on Wednesday, cautioning against any actions that violate the state's Unruh Civil Rights Act. This landmark California legislation explicitly prohibits discrimination based on sexual orientation and gender identity, including gender dysphoria. Bonta underscored that withholding gender-affirming care on such grounds would be a clear violation of this act. He further pointed out the potential breach of non-discrimination protections outlined in the Federal Affordable Care Act. This dual legal basis strengthens California's resolve to protect the rights. The state's commitment to this principle was previously demonstrated in a successful lawsuit against a gym that barred a transgender woman from the women's locker room, resulting in a significant damage award under the Unruh Act. This precedent firmly establishes the state's unwavering stance against anti-transgender discrimination. The proactive approach adopted by the California Attorney General's office mirrors similar actions taken elsewhere. New York Attorney General Letitia James also issued warnings to hospitals in her state, emphasizing the legal obligation to provide gender-affirming care. These coordinated efforts across multiple states showcase a determined resistance to politically motivated attacks on transgender healthcare access. The clear message emanating from these states is a staunch defense of the rights and well-being of the transgender community, emphasizing access to health care as a fundamental right rather than a privileged subject to political manipulation. The ongoing legal challenges underscore the urgency and importance of ensuring the continued provision of gender-affirming care to transgender youth across the country, preserving their health and future prospects. The legal battle ahead is expected to be protracted and complex, but the determination to protect access to life-saving care remains unwavering.